Good morning and welcome to the second episode of the EcoQuip Plus project's webinar series dedicated to health managers on how to harness the full potential of strategic procurement. EcoQuip Plus is an EU-funded project co-financed from the COSME program of the European Union. The webinar has been organized by the European Health Management Association, EMA. Our vision is excellent health management for a healthy Europe, which we fulfill by supporting the spread of knowledge and exchange on effective health. My name is Annette Rosanov, and I will moderate the session today. I'm the Program and Policy Director at EMA. Today's session will be dedicated to value-based procurement. We will look at how health managers can achieve better value in healthcare by making strategic use of procurement, and how they can incorporate the concept of value in their procurement processes. Those who followed the first webinar, we will continue on Kjetil's path, our passionate procurement expert who talked about procurement in broad. Before we introduce our speakers today, some housekeeping rules. Please keep your microphones muted during the whole session. If you have questions, please type them during the session anytime in the question and answer box, and we will respond to them after the discussion. The webinar is being recorded because we would like to make the recording and the follow-up report available for those who cannot make it today. We will be also live tweeting during the session, so please tag us at EcoQuip Plus if you would like to follow us on Twitter. And without further ado, I would like to introduce our speakers for today, Professor Louise Knight and Caterina Sampol. The first webinar, we had a TED Talk type of speech with Kjetil. Today, we will have an informal discussion with Louise and Caterina about value-based procurement. Professor Dr. Louise Knight is Professor of Public Sector and Health Procurement at the Universiteit Twente in the Netherlands. She's also part of the Urban Agenda Partnership, a network of national public procurement competence centers. Caterina Sampol is coordinator of Public Procurement for Innovation at Hospital de la Santa Creu and Sant Pau. Caterina has an interesting career path because she has always been working with procurement, but from different perspectives, as a policymaker, as a supplier, and now as a buyer. So let's start immediately this informal discussion, Louise and Caterina. We discussed in the we said in the introductory speech that health managers can include the concept of value in their procurement processes. But what is value? How do you define value? Louise, would you like to start?
That's an interesting question. So value refers to how important or useful something is to you. And of course, what's valuable kind of depends on your context. It's in the eye of the beholder. In a hospital context, a clinician might take a different view from a budget manager, from a procurement expert. But in the context here, where value-based healthcare moves from is about moving from paying for input to paying for outcomes. Value-based procurement is about moving away from buying just on the cost and looking for short-term savings, to thinking about long-term efficiencies and effectiveness. So it brings in trying to get the suppliers mobilizing the suppliers to getting strategic alignment such that actually we can deliver better outcomes from our organizational and patient perspective.
Caterina, would you like to reflect on that? Do you have some complementary views?
Yes. I agree with the definition of Louise, but also value is different from each stakeholder in a process and in a public service, because the public procurers, we procure services to create to comply with our mandate. So we need in value-based to look at all the needs of all the stakeholders in order to create a procurement that is balanced and everyone wins in this model. So the value-based healthcare is very important, is a guideline for all of us, but then we have to move to the procurement, where procurement should be sustainable, because in procurement we define commitments in the middle long term in order to achieve this value for other stakeholders, and that is something that is very rewarding and challenging process.
Thank you very much. Yeah. I have a question. Yes, Louise.
Yes, so it's very tightly linked to the innovation agenda and, of course, to sustainability issues. You cannot start to integrate environmental and social outcomes unless you start to take a different view from the traditional baseline of being price orientated and short-term savings orientated.
Yes, and also as to start, you need to have a problem to solve, a very important problem, because you need to change also the organization and how the organization approaches procurement, and this is also challenging.
Well, already this definition triggered a lot of questions in my mind. I don't know why we will follow the question and answer panel, but I would have some questions, but I will keep them to the end. And I was particularly happy that you already brought in the sustainability perspective. When we had the first episode, and Caterina was talking about how to use procurement in a strategic way, he already bridged us to value-based procurement, and now in the value-based procurement, we already focus the third topic of this webinar series for health managers, which will be about sustainability of procurement. So it just reconfirms how these topics are linked together. So how sustainability is also a value to respect. But let's move on and let's dig deeper into practice. So we heard about the theory. Let's see in practice. How do you experience value-based procurement in practice, in healthcare or in other sections? Caterina.
Thank you. And it is a very, very broad question, but I will try to narrow down and be very concise. We start with a big problem, a problem to solve where there is no clear solution for it. And we need to work together with the industry to solve this problem, and also to change how we are doing things currently, or how we are providing our services to our patients. I am in a hospital currently, and how this co-creation of the new model can be done, taking into account that the sustainability, again, that everyone values are achieved, and that is a balanced model. And to start, we start with a big problem, a good leader, because this leader has to be also supported by the direction and by all the team we have to appoint to change this kind of models. We need to appoint different knowledge inside the organization, from project management to clinicians to IT, probably IT experts, procurement experts, because we need to procure according to the procurement regulations, but in a different way. And work together on where is the value, how to construct, how to decide which are the better approaches that improve the value for all the stakeholders. And well, we need to start an important process. And this is the main points. How we started with a sample, with a problem, big problem, with a simple solution, because this is the way to start this change inside the organization. You need to start with a success with these changes, because this is important in order to adopt this this new way to approach to other fields.
Thanks very much, Caterina. So it is actually problem solution, including value, so including an approach and co-creation is what I heard saying you. And you mentioned already twice this change thing. I would like to come back to it later if you don't mind, but I would like to also listen to Louise. How do you see value-based procurement in practice?
Yes, it's very interesting, Caterina's emphasis on there needs to be a problem to solve, because that addresses one of the important issues that has been found through some of the research, which is that there can be a lot of resistance to initiatives. If, as Caterina says, there's a real and immediate and high-profile problem within the organization, that already takes away some of the resistance and enables a kind of an alignment and of incentives and an urgency to looking at this and to rethinking quite deeply how things are done. I'm sure there are many other areas where value-based procurement would be extremely important and valuable, where it might be linked to significantly reducing costs by bringing in new suppliers, changing clinical practices. But all too often there will either not be enough attention on the problem, or for various reasons, a lack of incentives or resistance. And in some parts of the public sectors, the resistance is, the research suggests resistance is higher in some areas than others. Higher in healthcare, perhaps, than I have a colleague who's done research in social housing and comments significantly on the difference. I don't know whether that's a cultural matter. Caterina can probably comment on that more.
Yeah, would you like to comment on, Caterina, the culture? Resistance.
Well, yes, it's a change of culture, and the change of culture. In fact, in all our value-based procurements, we have an important part of the contract that is intended to change management. That is the change of mind of the organization. That is very, very important. It's a new approach. Completely new, and we need also to prepare our processes to be aligned with this new model. So is an important change. That is why it's so important to start, in my opinion, with success, because then these barriers that are of change that are normally in the organizations can be addressed more easily.
And how do you promote this success, Caterina?
Success is, I don't think that success can be promoted. You need to choose very well where to start, because you need a challenge that is easily to be addressed. For instance, in our case, but maybe we can talk later on that. We started with a problem that was not very wide, very complex. We focused on a big problem that was easy to solve. And from that, we appointed all the team, and we started to make this organizational change, the change of mind inside the organization. And as it was a success, every one of the participants felt a rewarding. For instance, it was a change in treatment where nurses took an important role, and they felt empowered in this new role. All this is the program you have of change, organizational change. You have also to define in parallel of the procurement. Not everything is procured, but you also have to have resources to prepare the organization for the change.
Louise, would you like to reflect on that?
Yes, and I think
the success. Mm-hmm.
Yeah, it makes excellent sense to pick the right problem in the first place for getting the momentum going and for building enthusiasm and capability and mm-hmm. awareness of this possibilities for a different way of making decisions and implementing and running supplier relationships for outcomes. And I think this issue of engaging different parties across different stakeholders within systems is important. It also means a lot of engaging for procurement people. It's not normal procurement. It's not what we've been doing over the last many years. It does require a change of mindset, and a change of skill sets goes with that.
Also for the board of directors, they mm-hmm. have to support strongly, because this will require resources.
Yeah, involving the board of directors, indeed, that came out from the first episode, from the first webinar as well, and what the strategic role procurers have in that, because they have to speak a strategic language to the board of directors to convince them. I would like to stay a tiny bit on this change question, because to equip hospitals and whatever healthcare institution with qualified procurers who embrace the vision of value-based approach, and to make value-based procurement an attractive career path for young professionals and senior managers already on the job. Research, education, and training has a lot to do. Louise, what do you think as a professor?
Starting with the training side, and I'm not sure how much it's training sitting in a classroom versus on-the-job practice. From what Caterina has said, there is a really significant skill shift, and we're not just talking about procurement people, as we mentioned before. It's clinicians and managers who are having to work in new ways, collaboratively, and engaging with suppliers, because we're talking about procurement, but of course the procurement agents are there to help mobilize the suppliers. And it's a case of making sure that the top team are recognizing the importance of the supply base for successful performance at the hospital level. So yes, it's skills, but it's also that understanding and appreciation from top management. So those are the people in the roles now. From a research point of view, I think there's a lot to learn by doing deep case studies on the successful and unsuccessful projects that have been tried. So that's looking close up at what are the drivers of success and what are the barriers and so on, and doing that in order to enable learning across across projects and across organizations. But I also think there's something about a really big step back and looking at using research to understand more broadly things like incentives and resistance. Caterina's emphasis on getting the right problem is about dealing with avoiding resistance in the first place, and also where the opportunities lie in terms of trends in technology and so on, because how does value-based procurement play out differently, let's say in pharmaceuticals versus medical devices, and indeed should we be doing it around things like buying food and so on. So lots of things, but the final one was to do with future professionals. I teach a lot of business admin students, and I think when they first sign up, they assume they're going to work in the big name manufacturing companies. Now, I think it's super exciting to work in the hospital environment, but it's for example, the opportunity to be involved only some of the time. It's not the full-time job, it's some of the time in value-based projects, procurement projects, would be very motivating. It really shows the sort of the most exciting part of the role, as well as, sure, lots of other stuff has to be done. Not every job can be exciting in all aspects, but we need to make it attractive, and we need to show and share fantastic examples that we hear about, and encourage more people, more of my students, to come and work with people like Caterina.
Yeah, indeed, Caterina, I would like to turn to you and just ask, at the Hospital de la Santa Creu and Sant Pau, where you work, I imagine that you have loads of young professionals and also seniors in your job, whom you don't teach, but perhaps you train on the job, and you promote a value-based approach. How do you do that? And what is your experience? What is the success rate of convincing people?
Currently is quite high, but we have good Sherpas. In fact, what is important is that we need to train the different profiles inside the organization. To look at procurement in a different way, because for instance, in the usual procurement is of products, of some services in the IT field, but particularly is of products or devices and other equipments, medical equipment, that are very expensive, very innovative, with a lot of innovation going on. But the doctors normally look for what they offer, these products, but they don't look at the procurement as a strategic way to improve the way they treat all their their patients. So value-based requires that to focus on the whole value chain for the patient and really put the patient in the center, and innovate not only in a product or a service, but shift the focus to the outcomes, as at the beginning Louise said, no? And this requires a training also, and some kind of support, because they know where is the value. They know a lot of things, but not everything. And also they suppose what is expected by the patient, but they don't know, they are not patients. So these require a lot of training, a lot of change of mind.
And how did you use EU projects, Caterina, in that training?
What we do is learning by doing. I mean, we also create some workshops, internal workshops in the organizations where the success stories are explained and the lesson learned are also evidenced in order to promote this change of mind in other professionals in our organization. And what we do is a lot of support during this. In fact, my team is supporting the clinicians and the procurement and the other specialists in creating this new procurement, this new tendering, because it's quite difficult. It's not easy. You need to balance everything, what you are asking to the industry and what are you able to pay, no? And where is the balance? This is the important key, and this require some kind of support and someone that is also supporting every one of the leaders of each of the phases of the procurement. The technical, that is the clinician, where the patient has to be represented. The legal, that has also to adapt the normal procurement to this new way of approach, and the contracts has to be thought to be sustainable. And well, and also the industry, a lot of open discussion with industry has to be made, because if the change is important, no, it's not a recurrence. We have also recurrences in these models, that the second contract is easier for us to prepare. But well, still we have to listen to the industry, because maybe industry view is also changing, and we need also to have a clear view of what the patient is expecting.
Yes, also the first steps are the really difficult ones, aren't they, Caterina? Yeah. Okay. Louise, we mentioned that you are part of the Urban Agenda Partnership. Does that also facilitate exchange and learning and training and capacity building on value-based procurement, this network of national public procurement?
So there have been 14 partnerships, and one of them is around innovative and responsible public procurement. And yes, there are lots of efforts for learning in terms of, in the city context, how to work differently, especially with SMEs. There's a very strong emphasis on supporting the development of SMEs within the local economy. And there it's about how to work differently, either through innovating in your processes or with innovative products to develop, to improve value, where value is seen, rather than here we've been talking in the healthcare context with a patient-centered focus. Here we're looking in the city environment at outcomes to do with society within that city context, so the economics, but also as citizens.
So it's more local, and it's perhaps a bit smaller scale, is that? Well,
it's not necessarily just local, because clearly if a major innovation is needed, and for example, there's a big buyers network now, there it might be large companies as well.
Okay.
But within the municipalities and local government agenda, there's a strong emphasis on SMEs. And indeed, SMEs are crucial here. It's part of the picture. It's not just the large companies that need to be worked with in different ways. Very often, it might be a very small company that has a great product, but is really struggling to get it implemented, is really struggling to get uptake, despite good evidence in medical terms and indeed in cost benefit terms. It still requires maybe, for example, not just one group of clinicians to change their practice, but 2 or 3 groups how they work together, and then using new products. So if you lay all those variables put them all into the mix, that makes for a great deal of complex change, even around something that might appear at first glance relatively straightforward with a good evidence base. So yeah, there's different emphases in different places, but still the same concept of getting more value, of mobilizing suppliers to help deliver the better outcomes, whether you're taking care of people in a hospital environment or whether you're running a city. We public procurement people or healthcare procurement people need to work in different ways in order to do that.
I would have another question to both of you, and then if the audience can bear with us for a couple of minutes, and then we will turn to questions. We are still in the change and managing change field. So evidently there is a lot of change following or deriving from shifting to value-based procurement. But how do you manage that within an organization? So concretely, Caterina, if we could start with you, how did you manage that change within your hospital?
Well, first, the change we started with a small project with a big impact, where we appointed a team. We worked very hard together, clinicians with association of patients, with a support unit that was where I was working, and also with the legal team. What we did was to conduct an open market consultation with all the industry to share our challenge with them and to evaluate what has sense, what not, if the industry was prepared to offer what we were expecting. And then we started creating, we create a strong internal team with clinicians, with internal consultants, with legals, and with the IT professionals, where we started we worked in different levels. At the clinical level, we started to create all the key performance indicators, with the input from the patients, with the standards of value that we know from different organizations like ICHOM, etc. And we create the set of value indicators that should be also part of the solution we were procuring, because one important thing in this kind of procurements, if we want value, we have to measure this value. And how to measure this value, that raises important question that has to be answered or tried to answer by the team that is preparing this procurement. In one side, how we will measure value during the contract, which are the most important key factors of our contract to create this this value, and to create a collaboration with the provider, the contractor, and our organization in creating this value together. And also we have started to create a program to manage the change that has to be implemented in the organization to successfully implement the contract. And that is not part of the contract, it's part of the internal project. Of course, during the implementation, we established a governance of the contract, a governance model where the contractor and the procurer were working together and following all the change. The strong follow-up of this change and this new model is very, very important. It's not something that you buy at the price and then there is something that is continuous of providing. We shift, in fact, in our cases from procuring devices, implantable devices, to procure services. And then we established a set of rules in order to be able to provide the best device for each patient. And we also established the qualitative performance indicators that were easily measured and were collected and are collected. And we also established the payment according to a fluctuation of activity that we also defined in the rules in this sense. It's not, it was quite complex. You can simplify and you can have different approaches, but this worked for us. For the first was very, very strong, a big project, but as it was successful, we have been able to evolve.
Thank you. So I have noted here structural change, team change, new key KPIs, new governance model, from procurement to from devices to services, and the payment change as well. Louise, very quickly, would you like to add something to this change? And then we have a question, and our time is coming up.
More just to emphasize a general point, which is often made, not just in the context of value-based procurement, but speaking to Caterina's point, emphasis on contract management. In many places across many sectors, there's been a lot of developments on better procurement, but if that's not followed up with better contract management, it comes to nothing. So, for example, putting in green performance indicators and then not monitoring whether they're delivered. So, you know, without the monitoring, without the follow through, it simply won't make a difference. We can procure as beautifully as we like, but it won't be delivered. So the effort going into the contract management and making that very accessible and workable, that's also a huge part of the success of it.
Okay, that I forgot. Sorry. Yes, indeed, new contract and contract management. We have a question in the question and answer box. Could you? Yes, already unmuted. Thanks very much. Could you please ask your question? You can unmute yourself now. Suleiman, yes.
I want to know about that. Please share your insights on the bottom line improvement, because I'm also working with an healthcare organization of the United Arab Emirates, and we work with the multiple supplies, the multiple categories for the healthcare, how it the bottom line improvement, how it affects on that one, because through the what processes and what benefits. Because the bottom line improvement is very much important for the procurement. So what is your insights on the bottom line improvement? How we can go ahead with a kind of good and great bottom line improvement? Because in the end of the every annual year, we've been asked what were the contribution to the PNL, and finance isn't very on the backside of to know the EBITDA contribution and the bottom line.
Well, it's a difficult question. But
yeah, I understand, because I've been researching on, because see, I'm into the healthcare organizations where we work within every month we have to present our data and reports to the management. And they ask us what is your improvement, because they are sitting with many, we have a CFO, we have a FPA analysis, and all these finance people are sitting on a head. So they want to know how, if you're buying in capex or we are working on the capex or the contract management, how it's contributing to their EBITDA, because they are very much concerned about their EBITDA.
Well, I think that what is very important is to focus on what we want to address, and then to know what we are able to pay. Let me say, we need to have a budget that is reasonable for what we are asking, and we need to know what is reasonable. Okay. Mm-hmm. From that, we have to look at the value for the different stakeholders, and price is one, but what is important is to have a thorough analysis of what is sustainable. Yeah. Sorry for the word, because it's another webinar, but it's very important to have this reflection, and that maybe is not can't not be done by only one professional inside the organization. It has to be made with the different visions of the stakeholder, of the organization stakeholder. I mean, with this our challenge, our problem and our challenge, where we want to arrive. If we go in a traditional way, how we would approach and what could be the cost. Okay, those are questions to be worked inside this group of project leaders of this value change, and also then look at what the industry can help us, in which parts can help the industry in the change, and what we need internally to address all that. This is the point, and that all these parts have a cost, not only the procurement. We need to look at the different phases and what we need to achieve, the challenges in each of the phases. That is an important internal reflection that has to be done by different experts inside the organization. It's my view.
Yeah. Louise, would you like to complement the answer?
Yes, just to emphasize it. I mean, perhaps I'm reading between the lines of your question, but if you're working in a hospital environment where you are purely driven by costs with very heavy incentives for savings and so on, then I guess it comes down to finding one of those problems like Caterina described at the beginning, and indeed looking outside for other examples. But where is it possible to show through a relatively simple but sort of big hit project to actually deliver some benefits which are where you show that spend a little bit more than the lowest price, and you can yield significant benefits elsewhere in the value chain in the hospital. So better outcomes at lower cost.
Yeah, sure.
Without some evidence, you're not going to make your case.
No, that yeah, I understand. Evidence and reports and data is very much to understand. Generally, the past data and comparing to the what we have the present situation. So, and we have to work out on the disruptions also. And the most important is the supply collaboration innovation also.
Yes, and what Louise said is very important. Maybe in a process you are paying a little more, but if you look at the outcomes, probably in the overall value chain, you are paying less.
Mm-hmm.
Yeah. The overall value chain of the services, maybe a patient that is you pay more for the device you are using for this patient. Mm-hmm. But this patient will have less incomes in the hospital. So, and the health of the patient will improve also in the long term. Yeah. So, in global, you are more sustainable.
Mm-hmm. Yeah, sure.
You have to look at the global picture.
Yeah.
Only the procurement itself.
Suhail, did you get answer to your question?
Yeah.
Thank you for your question. Unfortunately, our time has elapsed. We are even over time. So I would like to now thank our speakers, Louise and Caterina, for the nice discussion. And I would like
the invitation.
Yes, with pleasure. And I would like to conclude a tiny put together what we have heard from you, and please compliment if I forgot something. What we have learned today about value-based procurement is that it's not easy, definitely not easy, but it is worth. So just make a start. The first steps are difficult, but go beyond that. It is not an option, but it's a must. If you have to manage resources carefully, which we always have to do, price-based procurement will not serve you, and particularly not in healthcare. If you have budget constraints, you have to innovate, and value-based procurement is one of the innovative solutions to turn to, but you have to look at long-term sustainability, as Caterina said, not only in an episode, in a narrow perspective, but the global picture. And don't be afraid, changes will come. Changes in teams, structure, governance, KPI, contract management, monitoring, payment, and which you will have to manage. But there are good practices that you can definitely consult. Would you like to add something to this summary, Louise and Caterina?
No, Annette is perfect.
I agree.
I took notes. I was fully with you. And now I would like to invite our audience to consult the Collaborative Buyers Forum on LinkedIn. My colleague Amy is just texting in the chat box the link. It is acquire information on joint procurement opportunities within the EcoQuip Plus project. And please watch out to our next webinar, which we already talked about procurement. Preliminary date is the 25th of November. So please save the date. And thanks very much once again, Caterina and Louise. We will follow up with the recording and the short report, which we will post on the EcoQuip website. And of course, we will also promote that on the EMA and the EcoQuip Plus channels. And I would like to also thank my colleague Amy Weller, who was managing this webinar in the back. Thank you very much. And the audience, see you next time on the 25th of November.
Thank you.
Have a good
Bye.
afternoon.
Thank you.
Bye-bye. Bye.